Hi, we're always glad to have you here. Good morning and welcome into HealthWise, the TV show. I'm your host, Ralph Hipp. Varicose veins, that's what we're talking about today. A common concern as we all get older, particularly, of course, for women. And they're not just a cosmetic concern for you. Varicose veins can cause tired or painful aching legs for you, could even lead to some chronic wounds. Jamie Fowles is my guest on the HealthWise show today, and Jamie's an advanced practice registered nurse from the Vein Clinic of Cotton O'Neill's Heart Center, and with me today to talk about treatment options for varicose veins available to those of you who might be suffering from those. Jamie, welcome. I'm delighted to meet you and have you come to our table and chat about this very important health issue.
Nice to be here.
Well, for those of you women who have them, have had them for years, or you have been worrying for years about getting varicose veins, Jamie Fowles, what do we define as varicose veins? What are they?
Well, most people, when they think about varicose veins, they think about the big, ugly, ropey veins that they see on their legs, or
and that everybody else is seeing on their legs.
Everybody else sees, yeah. Or the little blue spider veins that everybody sees, or that the grandkids think are bruises, or what's going on with grandma's legs or mom's legs. But unfortunately, there generally is an underlying condition going on. Veins, there's a big network of veins in the legs, excuse me, that work with valves. The veins in the legs work with valves, and the valves are supposed to completely close and keep the blood moving up and out of the leg. Over time, as we age, although varicose veins can happen at any age, but as we age, it is a risk factor that these veins can become weak and the valves can start to weaken and spread apart and not work as well as they used to. And that will actually allow the blood to go backwards. And when that blood goes backwards, it starts to pool in the lower legs, and that can result in varicose veins. Over that, it can cause other symptoms like you were saying, the pain, the aching, the cramping. You can get swelling. You can get the end result, or one of the worst things that you can get from chronic venous insufficiency, which is another long word for varicose veins, is
You call
wounds.
it CVI?
Yep.
You do call it CVI by the initials, right?
Are wounds that won't heal, and that's what we don't want to see people have, but that it is a common thing that some people do get.
I'm not sure, I did not know about that, and whether you're familiar that this could cause leg wounds if it's not treated in a fairly timely fashion. The larger ones, Jamie, and the spider vein varicose veins we see, are those two different types of diseases and tell me about the two different types.
Typically, yeah. The larger varicose veins typically are more of a medical condition. The spidery, the little purple ones, they're more of a cosmetic condition. The varicose veins are more from the valves not functioning very well, the backwards flow of blood. The spidery veins are more of a cosmetic condition where the little veins are just breaking under the skin.
All right, so the larger ones and the smaller ones, two different treatment options or many different treatment options available for those? Let's start with the larger ones. What do you do in those cases?
For the larger ones, there is the medical treatment for the larger ones. It's minimally invasive. I don't know if you've heard of the vein stripping that they used to do. It was more of a invasive treatment that they used to do. It consisted of going into the operating room and having a pretty invasive procedure done, and a lot of people didn't really want to do that and don't want to do that.
Or any medication involved in that too? Or it's all the invasive procedure? The
invasive procedure that they used to do consisted of being put under, and it was a big surgery. The ablation procedure that we do now, the vein ablation procedure that we do now, the minimally invasive procedure we do now, is actually done right at the clinic. And it consists of, it's a catheter-based procedure. You're in and out within an hour at the clinic. You can drive yourself into the procedure, drive yourself home.
How about for spider veins? Let's talk about the treatment for those. And that's mostly the cosmetic concerns that I just don't like the way they look.
For the ones that you just don't like the way they look, it doesn't have a lot of associated pain or aching or cramping or anything like that. It's called sclerotherapy, and that's a lot of little injections. It's a medicine that we inject into those little spider veins. I'm actually the one that does the sclerotherapy treatments for those, and that medicine's just injected into those veins, and it helps those veins seal up, and that purple spider vein goes away.
Holy cow. About how long does it take to do the treatment, and how long would it take for those to vanish?
About 30 minutes is what we allow for the treatment. Generally 2 to 3 weeks or maybe a month or so before you can see them vanish per se, but sometimes it takes a couple treatments before that completely happens.
All right, we're just a couple of minutes away, Jamie, from our exercise segment. That's got to be good for controlling this. How do we avoid getting varicose veins?
Absolutely. A lot of it is genetics, so some of the things you just can't avoid from doing it, but compression stockings is a huge one, and exercising, staying active, walking, and keeping your weight under control, and just being active.
My wife and I wear the compression socks when we fly on long trips.
Absolutely.
We've taken European trips through the station. Great for that, but it's great to wear those on a fairly regular basis to avoid varicose veins.
Especially if you have a job, if you're on your feet a lot, or if you're sitting a lot. Those are risk factors. Pregnancy is a big risk factor, so if you wear them when you're pregnant, that does help too.
Okay. And Jamie, let's shoot the information to our folks at home. If you're interested in the therapies that Jamie Fowles talked about, the Cotton O'Neill Vein Clinic is where you'll find her. We were discussing varicose veins on HealthWise, the TV show. And the Vein Clinic is through the Cotton O'Neill Heart Center. Just remember 290-VEIN, 290-8346. Check them out on the StormontVail.org website. And you're at 9th and Mulvane. You're very close to the hospitals there.
That's correct.
We have a few seconds. Any final word, Jamie?
One final thing is that the cosmetic treatments generally are not covered by insurance. The medical procedures are generally covered by insurance.
Anything of cosmetic surgery, so remember that as well.
Yep.
All right, Jamie, thank you very much.
Thank
Talking
you.
about varicose
Absolutely.
veins. Hope you can hold those off, ladies and gentlemen too.
Yes,
Guys
absolutely.
get varicose veins.
Absolutely.
Hold those off for as long as you can and wear the compression socks. That sounds like a great idea, especially if you're on your feet on your job or activities for long periods of time. And the treatments that Jamie talked about, you can find out more about that. Interesting topic, wasn't it? And right now we'll get you some exercise. We have the HealthWise TV exercise segment. This is a great way to get in your low impact exercise on our show. And for 2017, we have that brand new group of exercise segments we'll be airing all this year. Some low impact moves. They're suitable for people of all ages. So get the kids and the grandkids and other family members together and check with your doctor before you try this or any other program.